what is pulmonary rehab?
Well, I'll start. So from a pulmonary perspective, we like to reintroduce activity. So many of our folks are sedentary, have been deconditioned for a number of years.
Right.
And so from day one of assessment, we're really looking to see what capacity the patient has to do exercise. And that's also part of the discussion is we separate physical activity from planned activity like exercise. Because the idea behind pulmonary rehabilitation is if we're going to show them what level of capacity they have left, hopefully we're going to get to a point at the end of rehab where they feel like they can go back to a facility and do exercise. Because that is planned and focused with a goal in mind. But physical activity for many of our folks can feel like running a marathon.
Right.
And so for many of our patients, that's the first step, is to determine what their capabilities are. And then from there we go through education. Mickey's mentioned that we'd like to make sure our folks are aware of COPD, aware what type of COPD they have. We go through medications, make sure that they're understanding what the medications are for, how to use them, when to use them, when not to use them.
It's a really comprehensive structure there. And Mickey, you mentioned that education, and how important is that to educate patients when they come to rehab?
Because when you're told that you have a diagnosis of COPD, what does that mean? I mean, there's several components of COPD.
Right.
So you need to learn and understand, well, do I have it because I have emphysema? Do I have it because I have bronchitis? Do I have it because I've had chronic asthma? And they have to keep in mind that it didn't just happen.
Right.
It's been there, and that's why it's chronic, but we need to learn how to handle it now.
Absolutely.
So it's learning that. One of the things I did want to mention about pulmonary rehab, we do talk a lot about exercise and who wants to exercise. So I think that we should not allow for the term exercise to keep us from doing it, because I don't want to exercise, I don't want to swim. But it's an individualized program. We work with each and every patient to individualize what their plan should be.
And it's all individualized, customized. It's not one size fits all.
We goal set. And we've had people come in, they want to do something simple as go to the grocery store. I want to do my own grocery shopping. And to be able to do that, you may not be able to do that in big steps, but you need to look at little components of it that will get you there. We've had people that come in, they wanted to play tennis again.
Right.
So how do we work with them to get them to be able to go back out on that tennis court?